Good morning. I will be dealing with systemic fluorides. Yes, systemic fluorides will be dealing with introduction. How do systemic fluorides work? Types of systemic fluoride compounds and the concentration, water fluoridation, and include definition, history of water fluoridation, the Grand Rapid Muskegon study, Newburgh Kingston study, then again different other studies, and including school water fluoridation, salt water fluoridation, milk fluoridation, and fluoride supplements. So coming down to introduction, systemic fluorides provides a low concentration of fluoride to the teeth over a long period of time. It circulates through the bloodstream and is incorporated into developing teeth. After teeth erupt, fluoride contacts teeth directly through saliva secretions. Most systemic fluorides have a topical fluoride effect, but their primary effect is systemic. So, how do systemic fluorides work? Systemic fluorides are those that are ingested into the body and become incorporated into forming two structures. Systemic fluorides, when ingested during tooth development, are deposited to some extent through the tooth surface. However, the actual mechanism of action of systemic fluorides is from topical protection, as the fluoride present in saliva, which continually baths the teeth, provides a constant source that is incorporated into plaque and facilitate remineralization. Types of systemic include water fluoridation, community water fluoridation, school water fluoridation, salt fluoridation, milk fluoridation, and fluoride tablets. Different fluoride compounds include these are the different fluoride compounds. Water fluoridation is defined as controlled adjustment of concentration of fluoride in a communal water supply so as to achieve maximum caries reduction and clinically insignificant level of fluorosis. And it presents a lower cost and long range, and recommended concentration varies from zero point 0.7 to 1.2 ppm depending on the average regional temperature. The optimal level of fluoride in water for protection against dental caries is approximately 1 part per million. The history of water. The first fluoride water program was started in the year 1945 in the four cities at the different studies. Grand Rapid Muskegon, that is January 25th, 1945, in the Muskegon town was kept as control. And then again, Newburgh Kingston study, that is Kingston town was kept as control. And then Evanston Oak Park study, where Evanston, Illinois was the intervention, and then again Oak Park was considered the control. All these studies produce a significant amount of DMF caries reduction, and it showed that systemic fluoride is actually effective. T. Columbus study is another very good example for systemic fluorides. Again, an optimum water fluoride concentration that include optimum levels, that is of calculating, that is in a climate high as 1.2 ppm and low as zero point 0.7 ppm. Pre-requirements for water fluoridation: presence of caries, DMF should be assessed, and there should be significant amount of caries in the community public. Level of fluoride concentrations in their drinking water, centralized water supply to community acceptance or approval, installation and maintenance cost. Material used in water fluoridation, there is three types: dry feeder, solution feeder, and saturation feeder. Dry compounds such as ammonium silicofluoride, fluorspar, sodium silicofluoride, etc. Solution of hydrofluorosilicic acid. And to maintain constant level of fluoride 0.8 to 1.2 ppm has to be maintained. This is a different saturator system. The dry feeder system includes the procedure, factor limiting usage, and the different recommendations. It's a solution feeder that works on the principle of volumetric pump, mostly suitable for large towns and cities. Advantages of water fluoride include large number of people are benefited, consumption is regular. During tooth formation, to make dental enamel more persistent to dental decay, all has topical effect through the release in saliva after ingestion. Fluoridation of community water is the least expensive way to provide fluoride to a large number of group of people. And disadvantage of water fluoridation include interference with human rights, and other modes are not considered. Common source of water supply may not be present. Feasibility in India is actually very low because of the lack of awareness. And mostly cities, town in India covering have piped water supply. There are no central supply system. That is one of the disadvantages. Coming to school water fluoridation is one of the another possible areas to be explored. This program helps in limiting caries in school students who are the prime concern. It is a suitable alternative where water fluoridation is not feasible. Procedure was first started in 1954 in St. Thomas, West Virgin Islands and used the public health service. Advantages include good results in reducing area, minimal equipment and not expensive. Disadvantages that children do not receive the benefit until they go to school. Not all the children go to school in poor countries and towns and villages. Amount of water drunk can't be regulated. Coming to salt, the salt production is controlled addition of fluoride, usually sodium or potassium fluoride during the manufacture of salt for human consumption. First fluoride salt was introduced by Vespa in Switzerland, and it has been on sale in Switzerland since 1955. Salt production is another like iodized salt we can be made it available. Batch processing, continuous processing are the two processes of salt fluoridation. Advantages and disadvantages. That's advantage of fluoride salt is safe. Theoretically, fluoride salt prevents dental caries. Does not require community water supply as in case of water fluoridation. It permits individual to accept or reject it. Low cost. Fluoride salt or iodized cal can be made available to the population. Disadvantage is no precise control over indicator consumption. International effort to reduce sodium uptake, less sodium intake to help hypertension. And then limitations include there may be large variations in salt intake because different people carry on with different type of consumption. It requires refined salt produced with modern technology and high level of technical expertise. The current view of high data salt intake may contribute to hypertension. Milk fluoridation. Milk fluoridation is the addition of measured quantity of fluoride to bottled packaged milk to be drunk by the children. It was introduced by Ziegler, a pediatrician. The rationale of milk fluoridation is the nutrition of milk has been well documented, and all milk products are suitable for fluoridation. Research has been demonstrated the effectiveness of fluoridated milk in preventing dental disease. Bioavailability of fluoride is not reduced by milk. Fluoridated milk keeps a permanent low level of iodized fluoride within the oral cavity, promoting remineralization. This topical mechanism contributes to the caries preventive effect of fluoridated milk. And planning a milk fluoridation program, dental health status, oral health status within community, especially to children, might be determined properly if the DMT among the children is moderate to very high. And then again, other fluoride sources and urine analysis when a decision has been made to implement milk fluoridation scheme. And the milk distribution include fluoridating the milk that include liquid and powder form. This is one of the another milk distribution programs. Compounds used for milk fluoridation include calcium fluoride, sodium fluoride, disodium monofluorophosphate, disodium silicofluoride. Feasibility in India, as of course milk fluoridation is advantages in addition to stable food. The problem is that major of the children are rural and urban areas cannot afford milk. That is one of the major problems. And another fluoride supplements include fluoride tablets, drops, lozenges, etc. Fluoride compounds mostly used are sodium fluoride, different according to concentration of drinking water according to ADA. Correct dosage in the concentration of fluoride in drinking water, age and weight of the children and other available fluoride. No more than 1 milligram fluoride should be ingested in each day from all indications for use. Benefits. Different benefits include the use of dietary supplements from birth to age in 13 to 16 years. Precautions include accidental ingestion of fluoride supplement can cause stomach upset. There is no risk of dental fluorosis if a proper regime is followed. And finally, to conclusion, the fluoride is a safe and effective agent that can be used to prevent dental caries. Fluoride has contributed profoundly to throughout the life to protect teeth against tooth decay. To ensure additional gains in oral health, systemic fluoride has been introduced. They provide low concentration of fluoride to the teeth over a long period of time. It is easy to administer throughout the various mediums like water, milk, and salt. Systemic fluorides helps in circulating fluorides in the bloodstream and is incorporated into developing teeth. But still, systemic fluorides are not yet widespread in India. Therefore, to ensure additional gains in oral health, practices of water fluoridation should be extended to additional communities, and toothpaste should be used widely. This is one of the major advantages and disadvantages and the applied level of systemic fluorides in India. with this, we have come to the end of systemic fluorides. Thank you.